Hey everyone, Tom Staley here. Today we're going to be talking about Medicare supplement plans. We're going to look at what plan options are available, which gaps they cover, and I'll even go on to show you which plans I found to be the most bang for your buck. Stay tuned. Today's lesson on Medicare supplements is pretty important, especially those that are just turning 65. For most of you that don't know, when you first turn 65, you're going to receive what's called your Medicare open enrollment window. And what that is it's a time where you can enroll in any Medicare supplement you want with any company you want, and they can't ask you a single health question. That's a beautiful thing because outside of this 6-month window, it's pretty short. If you ever want to add on a Medicare supplement, change plans, or change companies, you can do so at any time during the year, but now you have to answer health questions. So whenever I'm sitting down with someone who's turning 65, I always tell them, whatever decision we make, we better make sure it's the right one because the assumption that needs to be made is that you're going to have this plan for the rest of your life. So as we go through these plans, kind of keep that in mind. It's a pretty important decision. First off, Medicare supplements are totally optional. You're not required to enroll in a Medicare supplement. That being said, most people who enroll in Part A and B find it advantageous to go on and add a Medicare supplement because what they do is they work secondary to Part A and B and they cover the gaps left behind. And when I use that term gaps, I'm referring to things like deductibles, copays, and coinsurance, which are things you would be responsible for. These plans are offered through private insurance companies. So unlike Part A and B, which is through the federal government, these plans are offered by those big insurance companies that you're probably familiar with. And finally, there are no networks with Medicare supplements. So just like your Part A and B, you can go to any provider in the nation that accepts Medicare patients. This is really advantageous for people who do quite a bit of traveling. All right, so here we have the famous Medicare supplement chart. And it's titled Medigap Plans. And Medigap is just an interchangeable term for Medicare supplement. I understand there's a lot going on this chart, and you're probably wondering, what is all this? So I want to start by drawing your attention to the row at the very top of the page here. These are the 11 standardized Medicare supplement plans. And you can see it starts out with A and B. One quick distinction, this is not Part A and Part B of Medicare. These are Medicare Supplement Plan A and Medicare Supplement Plan B of Medicare. Totally separate, and that trips a lot of people up, so I like to make that distinction. On the far left column, we have the gaps left behind by Part A and B of Medicare. So without a supplement, these are costs that you would be responsible for. So to touch on a few of them, we have the Part A deductible, which is around $1,400 every time you go into the hospital. There's a Part B deductible, which is only $198 per year. Also, we have the Part B coinsurance, which is 20% of the doctor's bill. And there are quite a few other gaps on here, but these are typically the main gaps that people are looking to cover because they can be the most costly. So looking over at these plans, wherever it says 100%, that means that plan is totally covering that gap. And anywhere where there's an empty box, that means it's something you're still responsible for. Focusing on Plan A, you'll notice that it covers the top 4 gaps, leaving you responsible for the bottom 4. Plan A is pretty basic. Now, on the other end of the spectrum, if I focus on the Plan F, you'll notice that it covers every single gap in Medicare. Historically, Plan F has been the most popular plan. It's called the Cadillac plan. And that's because when you have a Plan F, the only costs you have are the premiums. There are no out-of-pocket costs because all the gaps are covered. So that made it really easy to budget for. No matter how many times you go to the doctor or how often you get sick, you would never receive a bill with the Plan F. Now, before I get you too excited for the Plan F, it is no longer available to anybody who turns 65 after January 1st of 2020. And actually, Medicare did away with 2 plans in 2020, the F and the Plan C. And you'll notice the common denominator between those 2 plans is that they both cover the Part B deductible. And if you recall from my previous videos, that Part B deductible is only $198 a year. So the reason why Medicare did away with these plans is because they want you to have a deductible. right? You're less likely to go to the doctor for a bump on your knee if you have a $198 deductible. It was simply an attempt to cut down on unnecessary doctor's visits. Now, don't feel like you're missing out on the Plan F if you do turn 65 after January of 2020, because to be honest with you, even before that date, if I had a client who was interested in the comprehensive Plan F, I would introduce them to the Plan G. Looking at the chart, the only difference between the F and the G is that the G does not cover that Part B deductible. And again, that's only $198 a year in 2020. And what you'll find is that the Plan F typically costs around $400 more per year in premiums than the Plan G. So from a numbers perspective, it didn't make sense to pay that much more in premiums to only cover a $198 deductible. So even before this 2020 change, Plan G was always a great option. All right, the final plan I want to touch on is the Plan N on the far right. It also does not cover the Part B deductible, so that's something you'd be responsible for. And it also does not cover the Part B excess charges. Excess charges are quite complex, but what it boils down to is whether or not your doctor accepts what's called Medicare assignment. If they do not accept Medicare assignment, that means they can charge 15% above Medicare's listed price for that service, and it's something you're responsible for. If they do accept Medicare assignment, then you do not have to worry about excess charges. And I will say most providers that accept Medicare patients also accept Medicare assignment, so it doesn't come into play all that often. Probably the biggest difference with the Plan N is if you look at the Part B coinsurance or copayment column, you notice that there are 3 little asterisks here. And if I go over to this box on the right and read that, essentially what it says is that you're going to pay $20 flat every time you go to the doctor. So without a supplement, you pay 20% of the bill. With a Plan N, you pay $20 flat. And with a Plan G, you don't pay anything. Also in that little box, it says that you'll be responsible for $50 flat for every emergency room visit. So when it comes to comparing the Plan G and the Plan N, a lot of the decision comes down to cost, right? What are the premiums? Well, since Plan G covers more, its premiums are usually more expensive, and vice versa for N, its premiums are usually less. So that being said, I like to go through this exercise where we get quotes for both a G and a Plan N, and we do a little break-even scenario. So what I mean by that is, if we know it costs $20 for each doctor's visit, I will find out how many times it will take for you to go to the doctor for one of the plans to make sense. And it's a really, really cool exercise, and it's worth doing. And finally, I want to talk about the companies that offer these plans. These are standardized. So what I mean by that, let's say I have company A over here offering a Plan G, and I have company B offering a Plan G. These plans are going to cover the same exact gaps in Medicare, meaning their coverage is totally the same. What we have to compare are the premiums they charge, company ratings, which is basically a letter grade indicating their customer service and things like that, and also an important factor, which is increase history. So your rates are going to go up. That's Insurance 101. The older you get, the riskier you are to an insurance company. So what we want to do is try to find a company that has a better track record of keeping your premiums low as you age. This shopping process is extremely important, especially if you recall the Medicare supplement open enrollment window, which is, a one-time window where you can enroll in any plan you want with any company you want, and there's no health questions asked. Outside that window, let's say, you enrolled in a plan and they were jacking your rates up 7% every year. Well, in order to switch, you have to pass health underwriting. So I'll spend a good bit of time going through this process with my clients because it really is an important time and you've got to make a good decision, especially considering that there's going to be around 50 different companies offering a Plan G or a Plan N in your zip code. If this shopping process sounds like something you might be interested in, please reach out to me. A lot of people don't realize that my services are totally free. Now, I'm compensated by the companies we decide to go with, but as an independent agent and representing just about every insurance company out there, I have no incentive as to which company we go with. So really, we just put our heads together and find the best plan for you. That wraps up our lesson on Medicare supplements. If you have any questions at all, please reach out. You can give me a call or shoot me an email. And if you're unaware, I have plenty of other videos on various Medicare topics, so be sure to check those out as well.